Hello, and thank you for joining us today. Today's workshop is aimed at helping you get a better understanding of what dementia is. Today we will talk about dementia, what it is and what it looks like, age-related changes in thinking and memory, cognitive impairment, and Alzheimer's disease, what it is and what it looks like, and warning signs of Alzheimer's disease. Before we go into depth on today's topic, let's talk about what memory changes are normal as we age. As we age, we may occasionally forget things and remember them later, like names of people, places, and objects. Our ability to learn new information may be challenging. Understanding information can sometimes take longer. If we develop other health issues that are not addressed, like hearing or vision problems, people can sometimes mistake these things for cognitive problems. It's important to remember that age-related memory changes do not interfere with daily functioning, like the ability to live independently, shop, and do chores. Dementia is a general term for a decline in mental ability that interferes with daily life. A person experiencing dementia may have memory loss and a decreased ability to think. There are different types of dementia, which is why we usually use the term Alzheimer's disease and related dementia. Today, we'll focus on the most common form of dementia, Alzheimer's disease. Let's talk about some types of memory loss that are not considered typical age-related changes and that require evaluation by a healthcare provider. We'll start with mild cognitive impairment. When a person has mild cognitive impairment, their memory and thinking changes, but they are still able to do most of their usual activities such as driving, cooking, dressing, and shopping. A person with mild cognitive impairment has an increased risk of developing Alzheimer's disease or related dementia. These changes can be noticed by the person with the impairment or by others who live, work, or care for the person over several months. Some of these changes may include being unable to balance a checkbook, having trouble making change or choosing a tip, or having to search for common words. After mild cognitive impairment is dementia. Alzheimer's disease is the result of nerve cells being destroyed and causing changes in brain tissue. These changes spread to other parts of the brain and cause problems with memory, thinking, and behavior. I'm sure you all have heard about Alzheimer's disease. What are some things you know about the disease? What do we know about Alzheimer's disease? Aging is a risk factor. Most people with AD are over 65. With this being said, it is still possible to have early onset Alzheimer's disease, meaning being diagnosed younger than 65. It generally continues to get worse over time. The course of the disease is individual. It is important to get medical care as soon as symptoms are identified. It is a chronic condition, meaning it never goes away. Alzheimer's disease can be genetic, environmental, or due to risks from health conditions and lifestyle. There have been new medications approved to treat Alzheimer's disease, known as anti-amyloid medications. Aducanumab and lecanemab are two examples you may have heard about. Although studies show they may be able to slow progression of Alzheimer's, it's still too early to see just how effective they are. Wider usage will give us more information. It is always best to speak with your healthcare provider about what is best for you. There are 3 stages of Alzheimer's disease. In the early stage, a person is able to function independently and participate in social activities, but this person will start having increasing difficulty with memory, thinking, and behavior. For example, coming up with the right word, remembering names of new people, performing regular tasks, forgetting material they just read, losing or misplacing a valuable object, and having trouble with planning or organizing. It's important to remember that someone with ADRD is still the same person. We don't have to be negative and focus on what is lost. Be positive and focus on what you and they can do. When a person enters the middle stage of Alzheimer's disease, they will have more difficulty with memory, thinking, and behavior. For example, they may have mood changes such as being sad, withdrawn, angry, or acting in unexpected ways. They may become confused about time and place or may confuse words. They may stop doing daily tasks such as bathing and cleaning. They may forget events and one's personal history. They may start to wander and become lost. A person in the late stages of Alzheimer's disease will require full-time, around-the-clock assistance with daily personal care, lose awareness of recent experiences and surroundings, experience changes in physical abilities including walking, sitting, and eventually swallowing, have difficulty communicating, and become vulnerable to infections, especially pneumonia and bed sores or pressure injuries. Let's go over some of the warning signs for Alzheimer's disease. Memory loss that disrupts daily life, such as forgetting recently learned information, asking the same questions over and over, or becoming more dependent on family members for things they used to do independently. Challenges in planning or solving problems, such as difficulty following a familiar recipe, keeping track of monthly bills, difficulty concentrating, or taking much longer to do things than they did before. Difficulty completing familiar tasks, such as getting to a familiar location, organizing a grocery list, or remembering the rules of a favorite game. Confusion with time or place, such as losing track of dates, seasons, and the passage of time. Having difficulty understanding something if it is not happening immediately. Trouble understanding visual images and spatial relationships, such as difficulty with balance and trouble reading. Some more warning signs include new problems with words in speaking or writing, such as having trouble following or joining a conversation, stopping in the middle of a conversation and having no idea how to continue, or repeating themselves. Misplacing things and being unable to find them, such as losing things and being unable to retrace their steps to find them again, or accusing others of stealing, especially as their disease progresses. Decreased or poor judgment, such as using poor judgment when dealing with money or paying less attention to grooming. Withdrawal from work or social activities. Persons living with Alzheimer's or other dementia may experience changes in their ability to hold or follow a conversation. Some examples include withdrawing from hobbies, social activities, or other engagements. And lastly, changes in mood and personality, such as becoming confused, suspicious, depressed, fearful, or anxious, or becoming easily upset at home, with friends, or when out of their comfort zone. What are some feelings a person with Alzheimer's disease and their loved ones may have? These are all understandable. It's important to be mindful of the emotions of the person living with dementia, loved ones, and caregivers. Not only does each person need support, but the emotions of one affects the others. They may be in denial. It is difficult to believe this diagnosis. Anger is another common emotion for you and loved ones. Neither can control the course of the disease. You may both feel sad and discouraged. However, depression is not normal, and you should discuss your symptoms with your healthcare provider. There may be resentment about this happening. You may both fear the consequences of the diagnosis and how it will affect each of you. You may both feel isolated. It may feel as though no one understands what you're both going through, and you are experiencing this alone. There may be a sense of loss. It may be difficult to accept that there will be memory loss. Know that these emotions are normal, but also remember that you or another person living with dementia are still the same person. Focus on strengths and highlight the positives. Taking part in activities that challenge you mentally and physically may have a preventative effect on memory. Managing chronic conditions like high blood pressure, cholesterol, and diabetes helps with risk management. Maintaining a healthy lifestyle like a healthy diet and exercise also helps. What are some ways you stay mentally and physically active? Your primary care providers or other healthcare professionals will evaluate you for dementia. If there are signs that something may be going on, you may be referred to a neurologist and other specialists. Working with your healthcare team is important to understanding and navigating the progression of Alzheimer's disease and any other dementia. It's important to be honest about your experiences, especially if something does not feel right for you. Today, we went over the differences between typical age-related changes and dementia. We also talked about warning signs for Alzheimer's disease or related dementia to look out for. We went over the early to late stages of Alzheimer's disease. Remember, it's important to work with your healthcare team. Thank you for coming to today's workshop. We hope that you will come back and attend some of our other workshops on ADRD or on one of our other workshop topics.